Dr. Bartoletti, our first question that we have for you is if you could kind of explain the beginnings of MDOT and how it came to be and how you became involved with it.
Okay, in fourth grade, I had a nun who collected all the outdated drugs in the state of Montana, and we sent them to Guatemala. And so me and a bunch of about 3 other students collected them, and it just made me curious to help for Guatemala. When I graduated from dental school, that's all I really wanted to do. I was going to take a year off and do work for the poor in New York at Father Reeder's house. Financially, I couldn't do it. 10 years later, I was walking through a dental convention and saw a group. Financially, I couldn't do it, but I said I needed to do it, and when I'm older and I can do it, I physically won't be able to do it. So in about 2004, I set out to the Ukraine in the Chernobyl area, to an orphanage of kids disabled.
You could tell us about how many places, or name some of the places that you have been.
Let's see, I had a clinic in Haiti for about 5 or 6 years. I've been to Nicaragua in the jungle. I've been to Honduras 4 places. I've been to Moldova, which is the poorest Eastern Bloc, one of them. I've been to Serbia, Montenegro, and worked on the Albanians. I've been to Africa 3 times, 4 times, 4 or 5 times. That's it.
And throughout this process, the one consistency has been that you bring students with you every time. Why take students?
I started with my children only. I wanted to show them the world besides the materialistic thing in America. And then one time I took my son and his friends to prevent him from going to Mexico for spring break. And I saw the value of it. I take students basically, I want to teach the world that as Americans, we're gifted with everything and every opportunity, no matter what economic system you come from. There's chances over and over again to help people. Therefore, I believe every student who is a professional, especially whatever that may be, owes it back to society to be compassionate and to care for the world just because of how we were born. And there's no better place than a place like Africa or a refugee camp to know and to put guilt in somebody's mind for the rest of their life that people need help. And whether that be financially, verbally, or just even counseling.
Are there any future plans for MDOT?
Yeah, as long as my body holds out. There's really a need in Africa. I enjoy that, and I think the students grow from it the most. I would like to go to Nepal. We'll see what happens from there.
So why did you come?
I come for a number of reasons. One, I feel like I have a lot to give back. I feel like the gift that I've been given to do dentistry is something that I can share with the world and people that are in tremendous need. The second is to experience this with college students and with some family. It means a lot to me to be able to do these things with family, and I cherish that deeply.
And what's your biggest takeaway from this trip?
My biggest takeaway, I hope to have more compassion for people when I go home and try to have a more open mind and open eyes about what's going on around me and people who need help, and try to do the same thing there. Try to be a little more compassionate. Just knowing what people here are going through and how lucky we are to have everything that we have.
And what's your biggest takeaway from the trip?
I'd say my biggest takeaway is that no matter what you do, it can make a big impact on the people's lives here, whether it's as small as a smile and a wave when we drive by in the bus. It just makes them very, very happy. If you can make someone happy, doing something so small, I think there's a lot to say for that. So I think people realize that, yes, the situation here is not very good, but they don't really know what they can do, and I think it's a lot easier to help them than people think, because these people just are down to take anything. They need anything, and any help really does help them a lot.
Why did you come here?
I came on this trip because I wanted to do something different, something from the heart, and something that would make a difference for someone else.
I think this trip was a great opportunity to get outside of myself and perform selfless action in order to help others.
I'm so happy with the number of patients we've seen and the good we did while we're here in just 3.5 days. Shooting for 400 patients, and I think we'll be there in just the next couple hours, and I will take that back with me.
Brought my faith back, so to speak, and I think a lot of the bigger picture and less about myself. So it's a humbling experience, and I think it's a maturing experience. And, yeah, I'm very thankful.
I think my biggest takeaway from an experience like this is just how fortunate we are. I mean, we really did kind of win the genetic lottery. If you think about it, like being born in the United States, we don't suffer with near as much as a lot of the people here that we've met at this refugee settlement. I mean, there are people here from the Congo, Burundi, Somalia, Ethiopia, fleeing from troubles with the governments, oppressive governments and dictators, terrorism, things like that, starvation, civil wars. I mean, we really don't quite understand it. And so I guess after trips like this, you oftentimes you appreciate what you have when you get home, and it happens for a short while, and then that feeling goes away. And I guess I just hope that I, from this experience, can take away maybe that feeling for a little bit longer than I have been able to in the past.
I think there was one little boy the second day, and we had to pull, I think, 4 teeth on him. And I thought that he was going to be crying, yelling, making a ruckus. But he really stuck with it, and after every teeth that we pulled, he smiled and he laughed and he gave us, a high five, and I thought that was a kind of a good representation of the people here and how brave and how strong, and no matter how hard of a life they might have, they still find that shining light and have a really optimistic view on life. So I thought that was really, really neat.
Be thankful for what you have, even if you don't have much. We have.
This is the second year I'm coming to help them here, and this really appreciate it, because there is no one who has ever done this. There is no one who can come as a dancer and work on them. That's why they appreciate it.
Excellent. If people were interested in getting involved in this process, whether it be through sponsorship or donation or anything, how can people participate in this endeavor with you? How do they reach you? How do they get in contact with this tremendous opportunity?
See, my email is mdot56@hotmail.com. The best way is to sponsor a student, because if the student needs a sponsorship, those are the ones that are the best to take. In other words, they work to pay their way. Most students paid me checks every 3 or 4 months to come here and worked on the side in college. Those are your valuable ones. They're flexible, they're impressionable, and they can change the world in the future along with me. My goal is that some of these kids return to their profession and help the world too.
Thank you.